it's really good that some new launches took place. Not definitely the patented drugs, but some of those drugs which were off patent in US and all, they were started in India. Overall trend of new launches indicate NLEP drugs during the post-acquisition period is neutral to positive. So it's not negative, it's neutral to positive. A pace of launch of new drug, I just looking to trend of API sales. India, as you know, is mostly the front end. We are not back end. We just do the formulations, we do tableting, we do that kind of thing. We mostly import bulk from China, and we are vulnerable for supply side shock from China. So we looked into the post-acquisition, what happened to API versus formulation. And luckily for us, this is positive. The companies have started investing in API manufacturing in India. Again, the Make in India comes in two sense here. Because earlier we were importing all these APIs from China, but now this acquisition, post-acquisition, these companies are putting in effort in make these API active pharma ingredients and intermediate ingredients in India, which is again a good sign. Level of coverage, as I told you, is a little problem in terms of the rural areas. They have not yet penetrated in those markets, so that remains an issue. Again, different company-wise, the Orchid Pharmaceuticals and all, they have really increased the penetration, but other companies have not increased penetration in the rural areas. Product availability, again, it's a neutral. There's not much growth in the lower towns as compared to overall growth of the company. So largely the growth has been restricted to tier 1 and tier 2 cities and not in the tier 3 or the lower towns. In therapeutic area-wise, we looked into the which areas, again, this area where the high margins of drugs prices are there. There is much more growth of those areas as compared to those areas where the margins are less. But luckily, good thing for us is that almost 650 drugs are on the national list of essential medicines. They have not been discontinued, the production has been speeded up, and we are manufacturing active pharma for those essential medicines, so that is really good sign for us. On impact on R&D, I think much of the major premise was that our investment in R&D would go up. Unfortunately, we don't see much evidence of stepping up investments of R&D in the Indian industry by the acquired industry in India. So this is one area where lots of work needs to be done. R&D was a big premise for us that a lot of research and development technology would come in India. We would manufacture new drugs here. The fast tracking of patents would take place here. That didn't take place. So that's a little bit of gambler because no innovative drug was launched during the study period by these companies. Expenditures are almost pre and post, it remains almost